This is our second amputation training day. I hope this film and our film from our previous event provide you with a comprehensive introduction to issues faced by amputees, plus those treating and representing them. The solicitor's relationship with an individual who has undergone an amputation lasts approximately 3 to 5 years, sometimes longer. During this time period, tremendous changes take place in people's lives. The resilience and determination of individuals, their family and loved ones can be very inspiring.
The most important thing is to take early advice from specialist solicitors who will put you into contact with the next stages if you do have a case, and those next stages are reputable, experienced experts. If possible, to get an early payment on account called interim payment, and they're to use that money to set up full rehabilitation. The people that the lawyers tend to see are in another demographic. They're the 500 to 650 cases a year through road traffic accidents that result in amputations, and 90% of those are under 65.
The role of the solicitor is to understand each individual and how the episode that has led to the amputation affects their life as a whole. The solicitor needs to explain the legal process from start to finish to enable the person to factor the steps in the legal process into their plans for the future. The client will want and need to get their independence and self-respect back as soon as possible. Access to rehabilitation experts and long-term access to multiple state-of-the-art prosthetics are central to these needs.
Solicitors are crucial. They're the central person who drives the case. They facilitate communication between the rehabilitation team and the person who's about to receive treatment, but also to facilitate resources, because unless there are resources to drive the process forward, then the whole thing comes to an end. So a good solicitor is one who's on top of their game, and he's preparing for things ahead of time. We all share the same aim, that we want to see the patient restored back to their family, to their community, to their work. And this includes not just the solicitor, but the insurance company, all the people providing a service to it. So we must remember, when we deal with patients medical legally, the amputee is generally young and fit. Early intervention, to my mind, is absolutely crucial. Delay causes deconditioning of the patient. They get weaker, they get contractures and stiffness in their joints, their muscles deteriorate, and above all, psychologically, it doesn't help their recovery. But the proportion of people with diabetes-related conditions that lead to amputation is increasing nationally, and this is happening in all countries. Even in India, the number of people with diabetes coming to amputation is increasing hugely. We're seeing more and more people coming back from war zones with 2, 3, 4 limb deficiencies now. Rehabilitation is an artificial construct. There are definitions about rehabilitation which suggest that it's restoring a person to their previous level of function and ability. I think rehabilitation has to be to prepare a person and to maximize their function so that they can live the kind of lifestyle that they desire. To achieve that, the quicker we start the rehabilitation process, the better. We can start treatment, and I think we can also start a relationship, an ongoing personal relationship with the patient, so they get trust in the rehabilitation team. What we try and achieve should never be clouded by our perceptions of what it looks like or what it feels like and so forth. It's aspirations of the person that are the key that we should be listening for. How should we manage the amputee? I think principally maximize gain and minimize loss. Things we try and achieve is function, independence, besides all the other attributes. And what is the end point? If you start on this journey, what's the end point for your rehabilitation? That's our philosophy, to convert this patient
we run a specialist service for severe limb trauma at Frenchay, North Bristol. It's a subspecialty that's grown over the last, I'd say, decade. I've been a consultant since 2002, which is probably where my sort of career progression has occurred. And I declared an interest in this because I realised that it was a subspecialty within both orthopaedics and plastic surgery, which was bridged very poorly. I mean, major trauma is life-threatening. Traumatic amputations are not easy. We often forget there's a patient attached to the wound, and we have to sort of take note of that. We also have these sophisticated techniques to help these individuals because they require help and assistance throughout their remaining life, but also that they can contribute back, as you've seen in the papers I've mentioned, into society and be a very active role in society.
A psychologist involved in amputation cases would be looking at adjustment issues that are outside of the norm. So, for example, it's quite understandable that people will go through some periods of bereavement and possibly even low mood, PTSD if they've had a traumatic amputation, and also anxieties. If you have issues particularly relating to your pain, you really need a pain psychologist. If your problem is depression and it is fairly severe, then I would always say bring in the psychiatrists or the GPs. So it's very, very common for people with amputations to have phantom limb pain or also some residual stump pain. And it's incredible to get the mind involved in handling pain better. Something in the region of 60 to 80% of amputees experiencing phantom limb pain. The best way to reduce phantom limb pain is to manage the stump pain aggressively, because pain gets quite quickly into a positive pathological feedback loop. So if you initially have a lot of pain and you don't tackle it, your brain will respond quite quickly. There's a lot one can do from a psychological point of view to impact on pain, and it's important to understand what sort of meaning a person attributes to pain.
The type of support that REACH offers is for families with children who are born or who lose an upper limb. We provide a helpline, we provide local branches around the UK and Ireland. We have a REACH family weekend where families can get together and share experiences, learn, network, have fun. Annual Outward Bound Week, or the REACH Activity Week, for children over the age of 10 who all get together. Everybody on that week are REACH children. They're either REACH children that are grown up and are there as helpers, or REACH children, and it's about ability, not disability.
Each client is different and will have different individual lifestyle needs. The quality of prosthetic hands and legs have increased substantially in the last decade, and remarkable results can be achieved. The solicitor needs to ensure that compensation recovered enables each individual as far as possible to meet the challenges of the rest of their life.